In the beginning, so others might eat was a simple act of kindness at lunchtime. 40 years and more than 10 million meals later, SUM's program's advocacy efforts, volunteers and donors have expanded and multiplied. But the core mission remains the same: break the cycle of homelessness in our nation's capital and restore hope and dignity, one person at a time.
Father McKenna, who started SUM, So Others Might Eat 40 years ago, wanted to not only serve hungry and homeless people, but they also wanted to, at the beginning, to try to help people overcome what keeps them homeless. And we have over 6,000 people living on the streets of Washington, D.C., which is an enormous amount of people. And so that's the people that we're really here to serve.
SUM serves breakfast and lunch 7 days of the week, every day of the year. More than 900 hot meals are served to hungry men, women, and children each day. A warm meal served in a welcoming environment is the first step many homeless men and women take to rebuild their lives.
Guests come here. This is usually their first stop in order for them in a lot of services here in the dining room. And once we develop relationships with him, we talk about our other services that we offer. We offer dental, medical, substance abuse treatment, case management, low-income housing for individuals and families as well. We really try to greet each person with a good morning, good afternoon, how are you doing? We really work on developing relationships with them. And after we build a trust with them, we try to provide other services to them as well.
Volunteers are the lifeblood of SUM's emergency services. Over the years, more than 180,000 volunteers have shared their time, energy, and positive attitudes since SUM began.
We can't do this without volunteers. They're a big help here in the dining room. They help us with everything that we do here, from cooking the meals to help serving the meals as well.
Across the street from the dining room, at SUM's medical and dental clinics, more than 50 homeless and poor adults receive services every day. SUM's mental health services are designed to diagnose, stabilize, and treat the mentally ill.
We are a primary care clinic serving homeless adults in DC, and we provide a variety of primary care services. We basically want to be somebody's medical home, so the same way that you would go to your primary care physician, we serve the same role for our patients. So they come in for physical exams, for checkups, for acute needs, for lab work. We do lab work here. We have psychiatry services here. We have an eye doctor who comes about once a week. We have a podiatrist who comes about once a month. And then we have registered nurses who also see patients and help them manage their medications by helping them fill pill planners or by doing some education about their health or their diseases.
After immediate needs are met, SUM focuses on services that empower people to rebuild their lives. The Center for Employee Training helps homeless and poor students learn skills to secure full-time jobs that pay a living wage.
Basic carpentry, plumbing, electronics, heating and air conditioning, blueprints, and computer skills. So hopefully maybe one day my own business, will help me just to, to grow, get instead of just working a regular job, have a career, and just a more, meaningful life, for me and my family.
SUM offers a comprehensive treatment program for men and women ready to break the bonds of drug and alcohol addiction. In 1991, SUM opened Exodus House, a 90-day residential treatment facility in West Virginia, ushering in a fulfilling new chapter in SUM's mission. Together with Maya Angelou House, the women's residential facility that opened 5 years later, SUM provides the tools of self-empowerment and self-healing with a holistic approach. A stay at Exodus House and Maya Angelou House is an opportunity for total change and redirection, and filled with stories of courage, compassion, and hope. Many of the individuals who have experienced the program call the place Miracle Mountain. Early on, SUM recognized the need for secure housing for the formerly homeless as they transitioned from addiction to independence. The Transitional Housing Program was started in 1986. SUM's housing programs have expanded over the years. Providing permanent, affordable housing for poor DC residents is a core priority.
SUM decided years ago that one of the biggest needs in the city of Washington was for affordable housing. that being one of the major causes why people are homeless, not having a home. And so 20 years ago, we started to provide housing for individuals that were living on the streets. And since that time, we've continued to develop housing for people that are having difficulties. Some established a goal of establishing 1,000 units of housing for affordable housing in the city for people in need. And we're about a fourth of the way through. And so in the coming year, we're now under construction for 245 units of housing, some for families, one building for the elderly, the rest for individuals that are in recovery or have mental health problems, people that just are struggling to exist.
Many of the most vulnerable members of our community are the elderly poor. SUM's Senior Services was a natural outgrowth of SUM's work. SUM's programs for the aged poor include a senior day center, a shelter for the abused elderly, the Interfaith Caregivers Program, and the SUM Senior Citizen Summer Camp. SUM is fortunate to receive support from individuals, corporations, and foundations, even in the most difficult of times. Whether we are remembered in will and estate plans, funded by a federal grant, or supported by small donations from individual donors, every dollar helps. It is the support of caring friends in the community, the enthusiasm of our volunteers, and their passionate commitment to our mission to break the cycle of homelessness that has sustained SUM for 40 years. What does the future hold? We will continue to meet the needs of the poor and homeless.